People a chance to move down. Okay, I will try to talk somewhat loud, but I'm limited in terms of how far I can move because of this microphone, so I'll do the best that I can. Before I jump into the recommendations, I want to give you an idea of what the Medical RX Subcommittee reviewed in terms of how they came to these conclusions and the recommendations. The first thing I want to do is just touch on the healthcare landscape. Certainly, all of us know that healthcare costs are increasing, but I want to share with you specifically what the Medical RX Subcommittee considered when they made these recommendations for next year. Just hit it again. If you consider the healthcare inflation index, and the fact that every year more procedures become available, new technology, new drugs, the healthcare committee is looking at a 10% increase. So if we did absolutely nothing and all of our members used the same number of services plus those new ones that are introduced to the market, we would have to consider a 10% increase with no plan changes. But as we know, healthcare is not stagnant. And the slide that I have up on the screen right now is an example of new technology. These are specialty medications that were introduced to the market in 2012. Specialty medications are those medications that are used to treat life-threatening serious conditions, such as cystic fibrosis, cancer, if you can read, colon cancer, prostate cancer, Cushing's disease. And if you can see the far right column, it represents the annual cost for just one member to take that particular medication. If you look at the Kalydeco, which is used to treat cystic fibrosis, that cost is $294,000 for one member to take. And these are just the specialty medications that were introduced in 2012. This is one of the fastest growing areas in terms of our healthcare dollars. These are incredible medications that save lives, they improve quality of life, but they are very, very expensive. And then I want to talk about the Affordable Care Act. The Affordable Care Act started in 2011, and there were a number of provisions that were implemented. The first one is the removal of pre-existing conditions for all members up to age 19. That extension will also include up to adults in 2014. There also was the removal of lifetime maximum. For those of you that have been in the Butler Health Plan for a number of years, you might remember that we used to have actually a lifetime limit of $2 million, and that was increased to $5 million. With the Affordable Care Act, there now is no maximum lifetime limit, and it really is not that unusual for us to have one member incur claims over $1 million just in 1 year, and I'm going to share some of those with you in a second. Also, with the Affordable Care Act, we had to increase the number of preventive services that we cover at 100%. And if you move on to 2012, 2013, can you go back one? One more. Go back one more. In 2012, there were a number of provisions that all health plans had to consider. These are not unique to Butler Health Plan. Contraceptive services are covered at a 100%, so that means that the health plans now pay 100% of those. Smoking cessation is now covered at 100%. And there are also taxes associated with the Affordable Care Act. The first one starts in 2013. It's called a PCORI tax, and every health plan has to pay a tax on every member that they cover. And in the first year, it starts at $1 per member, and that goes to $2 per member in the following year, and then escalates beyond. And if you keep in mind just the intent of the Affordable Care Act is to cover more people and to cover more procedures. So when you look at all of these increased taxes and increased benefits, just keep in mind that this is actually the objective of the Affordable Care Act, but it doesn't come without cost. So in 2014, there were a number of things that the committee had to consider. The first one is that employers now are required to cover all employees who work on average 30 hours or more. That is a new requirement. The second, which is important, which will impact you, is that co-pays will now track towards your deductible and your annual out-of-pocket limits. Currently, when you go to the physician office and you pay $25, those co-payments do not track towards your deductible or your maximum out-of-pocket for a given year, but starting in 2014, they will. Annual limits are prohibited, so previously health plans would have limits, say for example, on the number of visits you could have for a particular service. Those are all eliminated in 2014. One of the largest expenses that health plans have to consider next year when setting their premiums is that there is a transitional reinsurance tax, and this amounts to $63 per member that the health plan covers. So that means if you cover a family of 4, that's $63 times 4. And to give you some idea, for Butler Health Plan, that's about $800,000 a year of increased cost. It's an increased tax that we will have to pay. And finally, health plans will be required to cover the cost of clinical trials. Often, let's say medications, some of those specialty medications that I shared, before they become FDA approved, they are often introduced into clinical trials. Previously, health plans have not covered services that aren't approved by the FDA, but starting in 2014, health plans will be required to cover all cost of clinical trials, not only the medications, but all of the services included. So these are all additional costs in addition to that 10% that I mentioned that the health plan had to consider. So now jumping to the recommendations for 2014. As Bob mentioned, there was representation from all of the districts on the Benefit Information Committee, and most of the districts were represented on the Medical RX Subcommittee. And what I'm going to share with you are the actual final recommendations. What you're not seeing are all the ideas that were considered but not recommended. One of the key recommendations is that a new plan be offered in addition to the PPO and the high deductible health plan, and it will be called Mercy Select. This is something that Butler Health Plan was able to do in conjunction with the Mercy Network. It will have some unique features from the PPO and the high deductible plan. It will have lower office co-payments for a primary care physician and a specialist visit. Patients will have access to their own medical records through MyChart. There are nurse care coordinators available within each of the Mercy primary care practices. And for members who choose this option, they will be required to select a primary care physician within the Mercy network. If you choose this plan option, you will need to use the Mercy network for your services. So that would include the primary care physicians, the specialist, as well as any hospitals if you require that service. There is coverage out of that network for emergency services. So for example, if you have chest pain and you go to Fort Hamilton Hospital, that would be covered. If they discharge you and it was indigestion, that would all be covered. If you go for a sprained ankle and they discharge you and tell you to follow up with an orthopedic surgeon, if you're in this plan, you then would be required to follow up with a Mercy specialist and use Mercy facilities for the follow-up care. Before I move on, and that's okay, you can leave that slide up. The reason that we are offering this with the Mercy network and not others is because at this time, Mercy is the only network in Southwest Ohio that has a number of a number of hospitals that you saw listed on the previous slide, and also have a large network of employed primary care physicians. So they are integrated into the Mercy network. It does include all of the Mercy hospitals, as well as Cincinnati Children's, Dayton Children's, and Columbus Children's. And it also includes Cincinnati Children's, the Liberty Township campus. If you would need services, I had an example of a transplant that is not provided in the Mercy network. Those would also be covered with prior authorization. For the PPO that you currently have, the committee is recommending that the primary care physician office copayment go from $25 to $30, and the specialist from $40 to $50, and the emergency room from $150 to $200. And this is based on a review of the other plans of schools in the area. These copayments seem to be the average. Now keep in mind that the copayment for the emergency room is waived if you go to the emergency room and you're actually admitted. And also remember that starting in 2014, all of those copayments will now track towards your deductible and your out-of-pocket limits, and they do not currently. You might remember last year that we went from a 3-tier level to a 2-tier. And one of the recommendations is that we change our out-of-pocket and deductibles to the 2-tier. And they're recommending that the individual deductible in the PPO go from $500 to $650, but that the family deductible actually be reduced from $1,500 to $1,300. And you will see in the preceding slides that to be consistent, the family deductible and out-of-pocket are now going to be 2 times the individual deductible. And that also is based on a review of the local market and seems to be consistent. I want to remind you that with the deductible, that can be reduced by $150 if you participate in the health risk assessment. So if you go through the health risk assessment, your deductible would actually be $500, not $650. I know that the screenings were already held for Hamilton. If you happen to have missed that, you still are eligible for the $150 deductible if you participate in the health risk assessment before August 1st. And you can do that by calling the number on the flyer. They will actually send a packet to your home, and then you can go to the lab, have your blood work done, have the results sent to you and your physician, and you still would be eligible for that credit on your deductible in 2014. And that applies to both the PPO and the high deductible health plan. This next slide is regarding the high deductible health plan. Again, the only change here is to reduce the family deductible from $5,500 to $5,000. You can go on to the next. I mentioned the out-of-pocket. The recommendation here is that it be reduced for the family from $6,000 to $4,000. Again, with the high deductible health plan, the recommendation is that the family out-of-pocket be reduced from $6,000 to $4,000. One of the recommendations is that Butler Health Plan adopt the same formulary that is currently used by STRS and SERS. And this formulary focuses on getting the member to take the most clinically effective and cost-effective medication. And it would actually eliminate one of our copayment tiers, which is currently $55. Right now, if you're in the PPO or the high deductible health plan, after you meet your deductible, you have copayments of $15 for generic, $35 for a preferred brand, or $55 for a non-formulary or non-preferred brand. And what the recommendation is that we would eliminate that $55 copayment. The $15 and the $35 would remain the same. Go to the next one. It's probably the easiest to explain if you look at it a specific example. A number of years ago when Crestor came on the market, that was the drug of choice for physicians for patients who had high cholesterol. That's just what they wrote the script for. Many patients, the drug was effective. They stayed on that medication for many years. Well, since that time, other brands have become available and other generics have become available to treat high cholesterol. So in this example, a member who is taking Crestor would receive a letter in October stating that Crestor would no longer be considered formulary as of January 1st. The letter would list alternatives and ask the member to discuss those alternatives with their physician. If the physician agrees that they can change to another drug to treat that condition, then they would make that change. And in this example, the copayment would actually be reduced from $35 to $15. If the physician does not agree that the member should change the medication, they would contact Express Scripts and the member would continue to take Crestor and continue to pay the $35. You might remember that during the past year, Walgreens went out of network for Express Scripts. We have been in discussions with Express Scripts, and what they have created are a number of networks. The committee is recommending that Butler Health Plan move to the Prime Network, which would include all of the major retail chains in the Cincinnati area with the exception of Walgreens. And that is because Walgreens continues to be the most expensive retail option, meaning that when you go and you have a prescription filled, even though you may pay $15, the health plan is paying more at Walgreens than it would pay at CVS or Kroger's or at others. So it is possible that before January 1st, Walgreens could enter into negotiations with Express Scripts and they could be back on this list. But as of right now, and it would include all of the chains that you see listed there. The committee is recommending that Butler Health Plan move to the industry standard and remove coverage of pharmacy benefits for secondary coverage. So what that means is if you have a spouse who has a plan that is primary and they are taking medications, you currently now have the ability to submit those claim forms for some reimbursement through Butler Health Plan as secondary. This would eliminate secondary coverage for pharmacy. Butler Health Plan has been unique from that perspective. Most plans have not covered this for a number of years. And the last recommendation impacts very few, if any, patients, but it is a change that most plans have made over the past 5 years. Members who have end-stage renal dialysis or end-stage renal failure and have dialysis actually become eligible for Medicare. It doesn't matter what age they are, it's just one of those unique benefits of Medicare. So if a member requires dialysis, Butler Health Plan will end up being the primary payer for several months, and then that member will automatically switch over to Medicare. What this recommendation is saying is that Butler Health Plan would pay the same rate that Medicare will pay once the patient becomes Medicare eligible. And the slide on the screen now is a summary of the 3 medical plan options that will be available in 2014. That's what you have in your handout. And I want to clarify that represents in-network benefits, not out-of-network benefits. Those have not changed with the exception of the Mercy program or the Mercy Select option, which again, the only coverage out of network would be for emergency or urgent care services. For the first time in a number of years, the dental subcommittee is making a recommendation that there actually be 3 plan options available for members in 2014. What you see is a comparison of those 3 plan options. The current plan, is that listed as high on here? Okay. The current plan option is the current dental plan that you have, the Butler Health Plan dental option. The reason that the committee is making the recommendation to have the mid and the non-ortho option is because at other districts, some employees pay a larger percentage of the dental premium, or in some cases, they actually pay 100% of the dental premium. And they asked Butler Health Plan to provide other options rather than just the one that we currently have in place. The mid-plan option has a higher deductible for the annual limit. It has a $1,500 current year benefit maximum versus $2,500, and the orthodontia benefit is $1,500 versus $1,800. The non-ortho option is just that. It has a higher annual deductible, it has a lower maximum annual benefit, and there is no orthodontia coverage. So again, this is just to make additional options available for those employees who wish maybe less dental coverage and don't need orthodontia options. We do not have the rates for the 3 medical plans or the 3 dental plans. Those are set in September of each year. So this meeting today is just to share with you the recommendations for the plan options and the plan changes for 2014. Can I answer any questions for you? Yes, sir.
Available now.
Okay.
They're part of our express scripts because we were off for a while, but now we're back with them.
That is correct. Walgreens,
If the thing goes through, they won't be in the future.
they will not be as of January 1st unless they reach a different agreement with Express Scripts. That is correct.
What I printed out, that last slide that you showed for dental, they're labeled high, mid, and low. Should I correct the top? Are the numbers below the same? I was trying to compare real quick. It was labeled differently when I printed it out.
Okay. Yes, we did change, and if you have high, mid, and low, the current is the high plan, the mid is the mid, and the low is the non-ortho dental option.
Copy, but I just want to make sure.
Yes.
Reduction for the deductible, if you're not currently signed up for any of these plans, if you decide to sign up in September, are you still eligible to have that blood work done, or?
Okay, that is a good question. The question is, if you're not currently enrolled in one of the medical plans and you decide to enroll during open enrollment, would you be eligible for the $150 credit off the annual deductible? And the answer is no. You would not be eligible for 2014. You would have to wait until the following year. And with the $150 deductible, spouses are also eligible. Not children, but it is employees and spouses. So if you went through the screening and your spouse did not, and they're covered with Butler Health Plan, and you want them to receive the $150 deductible, again, if you contact the telephone number on the flyer, they will send a packet to your home, and you can have your spouse go have their blood work done before August 1st.
If Butler County is the secondary one for your spouse, do you still do the 150 for the spouse, or does it have to be primary?
It does not have to be primary. If you cover your spouse as secondary and you want them to have the $150 credit, you can do that.
You did the screening this year, that 150 scores next year.
That the question was, the $150 credit is applicable to the 2014 plan year.
How do you just have to ask your doctor if he's in that Mercy group, or how would we find that out?
Okay. During open enrollment, we will have a complete list of the Mercy physicians that are available. So we're not asking you to make a decision today about plan choices, but before you would select the Mercy network, we will provide you an extensive list, and then you can decide if your providers are included and if that is right for you.
If I have a doctor's appointment tomorrow, would they know if I ask them if they'll be in for Mercy Plan?
The question was, if you have a doctor's appointment tomorrow, could you ask them if they are part of the Mercy network? You could ask them. They may not be at this point, or if they are, they will tell you yes. But I do know that HealthSpan is working with a number of the specialists to bring them into that network, which is why we're not providing you a list today, because I know that there will be additional physicians prior to October 1st. But yes, by all means, you can ask them.
Do you have any recommendations when it's not a good time to be in Mercy Health Plan?
The question was recommendations if the Mercy Select is not a good option for you. Well, for example, if you do go to a physician who is primarily affiliated with another hospital that's not part of the Mercy network, then that would not be the right option for you. If you have a dependent who maybe lives out of the area and you need that dependent to use the multi-plan network to get in-network benefits, then this would not be a good option for you. I would say it's probably easier to answer who would it be a good option for. If you currently have a primary care physician who is part of the Mercy system, and that is your system of choice if you need services, then it is something that I would look at.
Is there any difference between who's in tier 1 and tier 2?
Okay. As of right now, there's no difference between Tier 1 in 2013 versus 2014. So, for example, Fort Hamilton Hospital and Atrium are both in Tier 1.
Is that list available now?
Yes, the Tier 1 list is available, and it's on the Butler Health Plan website.
Is Tier 1 and Tier 2 list?
Tier 1, there's a Tier 1 list available, and the Tier 2 would be all other health span facilities.
I'm sorry, all other,
Health span facilities. It's very difficult to really go out of network because HealthSpan does include all of the hospitals in the area. All of the hospitals in the Cincinnati area are in Tier 1, but when you get up to the Dayton area, there are some that are in Tier 2. They are still in network, but if you choose to go there for elective services, you do have an additional copayment and a little higher coinsurance.
I understand you say that if you are out of the area, there's an emergency, that would obviously be an out-of-network hospital and doctor room. That is covered because it's an emergency?
Yes, the question was if you are out of the area, if you're in Florida on vacation and you have an accident and you go to an urgent care or the emergency room, that is covered the same in all three plans, the PPO, the high deductible, or the Mercy Select. So emergency services are always covered.